Good morning, guys. Happy April snow day. I'm just gonna show you how it looks outside right now. Yeah, nice and white. So the purpose of my video today is discuss a root canal. So what is a root canal? First, before we get into the treatment of a root canal, I wanted to go over the basic anatomy of a tooth. So I got a little model over here, and you can see that the tooth consists of three main structures. The first one is the white part, outside layer of the tooth. This is where we see the crown of the tooth. That's enamel. The internal part, the yellow one, is a dentin, and then this part, the red and blue, that's our pulp. So the pulp consists of nerve and blood vessels, by which the tooth receives all the nutrients from the body. So what happens when we have to do root canal on the tooth? As the bacteria penetrate through the enamel, this is how a cavity looks on a tooth. So if we don't do anything about a very small, tiny cavity, the cavity starts developing, getting into the internal parts of the tooth. The minute the bacteria from the cavity reaches the internal pulp of the tooth, we have to do root canal, and we have to remove the capillaries and the nerve tissue from the tooth in order for this bacteria not to go further down and not to create an abscess in the bone. So by doing a root canal, what we do is we get an access to the pulp, to the internal part of the tooth. We have special instruments that we use to clean up mechanically, and special medications that we use to clean up chemically all this tissue from the inside of the tooth. And then we use a special sealer and a special filling material that goes right inside the canals of the tooth. And this is how we get a successful root canal, when we seal the tooth all the way to the inside of the apices of the roots. And then where the cavity used to be, we do a filling, and eventually you want to put a crown on the tooth so that it protects and it serves as a helmet for your teeth. Well, this is the basic information, and if you have any questions, let me know. Thank you.